Good afternoon, everyone. I'll call this meeting of the Standing Committee on Government Operations to order. We will start with a prayer. Please rise. Ms. Green.
We meet to serve our community, to use our resources wisely and well, to represent all members of our territory fairly, to make decisions that promote the common good. We recognize our responsibility to the past and the future, and the rights and needs of both individuals and community. As trusted servants, we seek blessings on our deliberations and our efforts here today. May we act wisely and well. Amen.
Thank you, Ms. Green. Please be seated. Committee, there's an agenda before us. Can I get a motion to accept the agenda? Thank you, Mr. Simpson. All in favor? The agenda is adopted. Declarations of conflict of interest. Hearing none, we'll begin with today's item of business, public briefing on Northwest Territories 911 operating budget and public awareness campaign with the Honourable Alfred Moses, Minister of Municipal and Community Affairs. Before we begin with the Minister's comments, I'll ask members to introduce themselves for the record, and we'll start with Mr. Simpson.
Good morning, R.J. Simpson, MLA for Hay River North.
Good afternoon, Shane Thompson, Nahende. Welcome.
Good afternoon, I'm Michael Nadley, MLA for Dexel.
Welcome, Julie Green, Yellowknife Centre.
Kevin O'Reilly, Frame Lake.
And I'm Kieran Tester, the member for Cam Lake and Chair of the Standing Committee on Government Operations. With me at the table are Jennifer Frankie Smith, the committee clerk, and our committee research advisor, April Taylor. Mr. Minister, if you'd like to proceed with any opening comments, and then you can move into your presentation. Just direct which one of your officials will be giving the presentation. Mr. Minister.
Great. Good afternoon, everyone. And Mr. Chairman, thank you for inviting me today to discuss the operating budget and public awareness campaign for the Northwest Territories 911 program. I would like to introduce the officials here with me today from the Municipal and Community Affairs. They are Eleanor Young on my immediate right, Deputy Minister, Ashley Garrity, the 911 Program Manager on my left, Kevin Brzezinski, Director of Public Safety in the back, Trish McFall, Manager of Policy and Planning, as well as my Ministerial Special Advisor, Ronna Sherigan, joining me here today. Mr. Chairman, a short presentation was provided to committee members in February, which was intended to guide our discussions about the now approved budget and our planned efforts to educate the public once the system goes live. Since providing this information, however, progress has been made on several fronts, and our focus has now shifted to preparing communities and completing the system build. As well, considerable work started this past March with telephone companies who, up until now, were waiting for the 911 Act to pass. As private companies responsible to shareholders, legislation was necessary before substantial work could start at their end. With the passage of the NWT 911 Act, all stakeholders are now hard at work making the necessary preparations. Although work remains ahead of us, the GNWT and key stakeholders are well positioned to achieve our goal of implementing a 911 or NWT-wide 911 system. With that, thank you, Mr. Chairman. I will now turn the floor over to Ms. Young to deliver the presentation, and I do look forward to hearing comments from the members and answer any questions. Thank you, Mr. Chairman.
Thank you, Mr. Minister. Ms. Young, you may proceed.
Thank you, Mr. Chair. Thank you to committee members for providing us the opportunity to update you on the implementation of our 911 program. As you know and can appreciate, there's a lot of different pieces and much work's underway to ensure that we're able to effectively launch 911 for NWT residents. With the legislation now passed and work well underway with the telephone companies to establish the infrastructure and the billing systems, many aspects of this work have evolved since you received this presentation, and so many of my comments will be what's changed since you received the written document in February. As the minister noted, our primary focus is working directly with communities to ensure a thorough understanding of the 911 system and its relationship to local services and our plan for public awareness. Given the complexity of the system and the necessity to ensure that we build it right, and we appreciated the committee's comments during the business planning process and the main estimates that, we will be watching all of these moving components and make sure we do it right, and we will revisit the go live date as part of that process, and I'll speak more to that in a little bit. So the slide speaking to fiscal and operational priorities, as previously indicated, communication to communities is where we started this initiative with several priorities in mind. Keeping the cost of the program low stands above all other priorities, and given that we're operating the system on a cost recovery basis, the addition to the legislation of capping the fee to $1.70 will certainly help maintain a desired level of predictability. Another important priority is achieving and maintaining a quality of service for NWT residents. Much like the Med Response program, our aim is to achieve a nationally recognized accreditation, which will form part of our overall evaluation framework. Another important success factor is ensuring good public awareness of the system. Last month, committee received an outline of our public awareness campaign, which will be used as the basic architecture for our public communications. A key element for this campaign will be to work closely with community governments to reach residents. We also see this as an important opportunity to strengthen the dialogue between 911 and local service providers. Based on the feedback we did receive from committee, we are actually planning to go to every community starting in late April, early May, to update councils with a presentation on 911 and speak to some of the local dynamics of implementation of 911 in their community. Also, moving forward, it'll be critical for us to evaluate progress as it relates to operating costs and revenue collection. So with the addition of reporting requirements to the 911 Act, the results of our data capture and evaluation efforts will be made available public. The final bullet on this slide speaks to our commitment to launch 911 by June, and as previously indicated, this target will be reevaluated shortly to ensure that it remains valid. Telecommunications preparatory work is a little beyond our control. Based on our initial discussions with the telco providers, we do think that there may be a little more time required than anticipated. Fortunately and unfortunately at the same time, this does provide us with an opportunity to spend a little bit more time working with communities to ensure good familiarity and comfort with the system. Any change in the regard to the go live date will be communicated with residents and stakeholders well in advance. One of our objectives here is to be fairly comfortable with that go live date when we announce it, and so if there's a change to it, we want to be fairly confident on what we're changing it to, rather than just saying we're going to delay it by a month and then it might take another month and it might take another month. What our goal here is over the next few weeks to be able to solidify all of the moving parts and be able to say with some confidence that the go live date will be whatever we announce. With regards to the operating model, this next slide provides a high-level snapshot of the operating model, which we've previously described to committee. Central to this model is the co-location arrangement between 911 and Med Response, which offers some synergies and economies of scale on various levels, such as having some surge capacity, as well as offering some good opportunities for cross-training. The location for the call center has been finalized and work is underway to prepare the space. All things coming together as planned currently. Med Response will move into this space in May as scheduled with the hospital relocation, and then 911 will occupy the space as soon as we're ready to go live. Public awareness efforts will commence immediately following, in advance and go live, but we will public communications will include signage near all communities accessible by highway, at airports, in all GNWT facilities, and we will work with communities to also try to have communications in all municipal-owned facilities as well. In year 2, our efforts will also include some web-based infomercials. Moving on to the next slide, specific to the language services. With our previous discussions at committee, there was a large point of interest about the availability of 911 services in official languages. Since providing this presentation, we have sent additional information to committee through letter detailing how the system will function in this regard. The contract services of this nature are quite common across Canada, and it's our aim to pay particular attention to ensuring that this service functions properly during the soft launch prior to go live. And I'll speak a little bit more about that concept of having a soft launch before the official go live date in a few minutes. Starting on the major cost driver slide, and again, this presentation, as you know, was prepared as we were getting ready to go into main estimates, so much of this you've seen through that process, but there is some detail here about the program's projected operating budget. As you can see by this slide, the majority of costs associated with 911 are, of course, staffing costs. National standards require that an adequate volume of coverage exists for the service, which operates around the clock. Fortunately, we're able to demonstrate, we're able to moderate this expense by co-locating with MedResponse. A major consideration moving forward will be to ensure that we have a clear understanding of the actual costs of the program and effectively balancing the cost with revenue generation. Of course, we've done estimates on what call volumes will be and things of that nature, but we really need to be operating to be able to validate all of those assumptions and be able to consider whether any adjustments need to be made moving forward. Of course, all efforts will be made to keep our operating costs as low as possible while maintaining a quality of service, and that'll be a large focus of our evaluation efforts. The next slide around the budget was contained in the 1920 main estimates for municipal affairs. As you can see, the projected budget does decrease by $116,000 in year 2 after the initial startup is complete. Much of the ongoing public awareness and training activities will shift to in-house resources at that point in time for training. Just as a point of interest, we did meet with city officials yesterday and talked about sharing training across with the city. We will be working from the same software, and so because we are working towards accredited standards, much like the city does, we do see some great opportunities for sharing in training with their staff and maintaining accreditation and sharing that training with staff as well. The next slide speaks to the estimated cost recovery fee. Of course, that was capped in the legislation at $1.70. Of course, if, as we get the final numbers in working with the telephone companies, etc., if the fee can be lower than $1.70, of course, we will pass that saving along to consumers. With the legislation now passed, as the minister mentioned, that was really the trigger for the telephone companies to really put any significant effort into doing the work that is needed to be done to sign in to the program with us. So they're busy putting the information together on phones and calculating fees and things of that nature that'll help us make the final determination on the fee. The fee will then be set in regulation. We're currently working on the draft of those regulations as we speak. It is important to emphasize that the projected cost recovery fee on the slide that was noted and the $1.70 cap does not include any system fees which could be applied by the telephone companies through CRTC. Again, those are a little bit unknown at this point in time. It is outside of the GNWT's control. We do have some idea of what some other jurisdictions are charged, but until we get the details of what the system will actually look like here, what the phone systems are or phone companies are signing into, we don't have any significant numbers calculated on what those fees may be. The next slide speaks to the public awareness campaign and the planned approach for public communications. Efforts to develop this material are underway now, and we should be well positioned to launch the awareness campaign when we have the estimated, or when we have confidence around the go live date and we're ready to go live. Again, there will be opportunities to work with our municipal partners to put campaign or put promotional materials in their facilities. We even spoke yesterday to the city about, they have signage on some of their vehicles. Is it possible to share some of that opportunity to put signs on their vehicles, et cetera? There's a willingness to work with us to find good ways to promote the transition into a 911 system and make sure the public is aware of the system. Once again, the evaluation framework gives us a means by which to ensure the effectiveness of our campaign, and if we need to change our approaches, we'll be able to make those adjustments after we do the initial evaluation and be able to change our program delivery design as we move forward. The next slide speaks a little bit to that performance measurement. There would be a program evaluation, and we are working centrally with the Management Board Secretariat to develop a suitable evaluation framework, and that will be the backbone of the evaluation. This, combined with public recording requirements that will be in the Act, should give us good information to ensure an accurate read on how well the program's performing and what, if any, changes need to be made to move forward. The final slide just gives you in a snapshot where we are at with the various pieces of the implementation. Things, as you can see, continue to progress. We have the bill assented to. We are working on the regulations. We've located a Center for Emergency Communications, and the retrofit is underway there. Much of the timing on the remaining items is subject to the final decision on a go-live date. At the end of the day, the hiring of staff will happen in time to put them to work so that we don't have people sitting without work to do, but we can get people hired and start training them and be ready for the soft launch of the system. And when I talk about a soft launch of the system, that's going to be our opportunity to test all of the phone trees that we're setting up with communities, to do actual phone calls, test the system, make sure it works and everything before we actually start putting the system in play and collecting fees for it. So we're anticipating, I believe it's a month to 6 weeks ahead of the actual go live date, we would be doing the soft launch of the system to make sure everything is operating. We are very hopeful at this point that by the time we're sitting in session in May, the minister will have some confidence with the telephone companies on when we will have a go-live date. As soon as we're able to have some confidence, we will announce that and start working towards that and make sure residents, stakeholders, yourselves, and everyone is aware of what that timeline will be. And that's it for the presentation. Thank you, Mr. Chair.
Thank you, Ms. Young. I'll now turn to committee for questions. Mr. Simpson?
Thank you. Thank you for the presentation. I have some questions about the fees. The presentation noted that the fees will be set in regulations. I was wondering how often these fees will be re-examined. Presumably the regulations will have to be changed to change the fees that are charged. So is this going to be done yearly, say after the first year, so that if the price, if it costs less to operate, that the fees will go down after the first year? Could I get some detail on that? Thanks, Mr. Chair.
Thank you, Mr. Simpson. Ms. Young?
So yes, we will be looking at things annually. As noted, there is a cap for the first 3 years, so obviously it will not increase at all over the first 3 years. If there is a reduction, yes, we would put that into play. Obviously, the first year or two, we're really going to be learning what costs are, and we'll be making some determinations on fee. But my anticipation would be that annually from that point on, we would be doing the review of the fees along with all of the data collection and program evaluation that we would be putting in place. Thank you, Mr. Chair.
Mr. Simpson?
Thank you. So say we have the $1.70 fee the first year per phone line, and it turns out that the cost to operate is $1.80. Would that additional 10 cents per phone line need to come from the Legislative Assembly? Is that the plan? Would that come through a supplementary appropriation? Thank you, Mr. Chair.
Ms. Young?
I think much like any situation within the government, we would look internally first to see if there was a way to absorb the cost before we would try to pass that on through a supplementary appropriation process. So, we would look at the implementation costs, if there's any flexibility within the program cost first, then within the department second, and then if required, bring it forward through the usual process through a sub appropriation.
Mr. Simpson?
Thank you. Yeah, my main concern is that I have two concerns. The one is that the cost is kept down. The last thing people need is another tax. But the other concern is that I don't want to sacrifice the efficiency and effectiveness of the system because of cost concerns. So if it does cost more than $1.70, I want to make sure that that is spent so we have an efficient system and we don't cut costs and degrade the quality of the system. You discussed the CRTC approved fees that could be levied by the phone company to cover the costs for systems operations and fee collection. There was no numbers given, but the witnesses noted that other jurisdictions charge these fees, or I guess the companies in the other jurisdictions charge these fees. So can we get a rough estimate of what, in addition to the $1.70, customers can expect to see on their bill in relation to this? Thank you.
Mr. Minister.
Thank you, Mr. Chair. And in the February presentation that we did give, and some of these questions that have come up before, this is going to be a learning process for everybody. We can't, we might not have the detail for some of those questions right now. Is something we're going to have to look at. The reporting that came out of the amendment that the committee did present, we are going to be doing that. We concurred to it. I concurred to it during the February sitting. And it's really going to be a learning process on what the cost is going to be. We are working with the telephone companies. And as you heard in the presentation, telephone companies weren't willing to do any work yet because they're putting in a big investment until that act got passed. And I appreciate the work that we did with the committee to get that act passed. And now they're doing the work. All the stakeholders are doing the work. We're doing our part to work with the communities across the Northwest Territories. So as that information comes up, we will keep committee apprised of the costs or through the reporting, obviously. And we're going to make a commitment to do the evaluating and monitoring of the program itself. There has been some initial talks between the telephone companies and CRTC, and it's different from jurisdiction to jurisdiction, I believe. And maybe a little bit for further detail, I'll go to Mr. Gary.
Mr. Garrity.
Thank you, Mr. Chair. What we know currently is that the Yukon pays an additional 30 cents per subscriber for landline only, and that's probably the most technically close to us environment. Our environment's a bit more complex because we do have 10 locations that are satellite based, but the telephone company, the incumbent telephone company, has a process where they put a submission into the CRTC, which has to be approved by the CRTC, and they're just starting that process now. So it's a bit of an unknown, but those are the numbers that we have from other jurisdictions that are close to us.
Thank you. Mr. Minister.
But just to make the member comfortable that that work is going on, and hopefully we'll get that information. We can share it with committee for sure.
Thank you. Mr. Simpson.
Thank you. Is there any timeline on when we might have some numbers related to those additional fees? Thanks.
Mr. Minister.
Currently, we don't have the timeline. We're working on the regulations. That's really the work for the telephone companies and CRTC on how much effort and work is being put into that. So we'll have to, we'll just continue to work with the telephone companies or stakeholders. And once we get that information, we will share it with members of the Legislative Assembly. Thank you.
Thank you, Mr. Minister. Mr. Simpson.
Thank you. And the fees that Northwest Tel could collect, or I guess whatever provider could collect, just to be clear, these aren't profit. This isn't a way to generate profit, right? I'm assuming the CRTC is doing a similar thing where it's pure cost recovery. Is that correct? Thank you.
Mr. Garrity.
Thank you, Mr. Chair. That's correct. It's cost recovery only.
Mr. Simpson.
Thank you. Nothing further. I'll have questions later on. Thanks.
Thank you, Mr. Simpson. Next, we have Ms. Green.
Okay. I thought I was going to sneeze. Okay. I have some questions about coverage. I'm wondering if during this process of moving the project forward, whether there have been any changes in the area that will be covered by 911. Thank you.
Mr. Garrity.
Thank you, Mr. Chair. No, it will be the entire Northwest Territories from day one. Thank you.
Mr. Minister?
Sorry, and just to add on to that, as you heard in the presentation, we are going to start doing our consultations with the municipalities and the communities. And as you heard, we already met with some of the staff here in Yellowknife to start working on that.
Ms. Green?
Yeah, I'll ask a more specific question. Last week I was on the Inuvik to Tuck Highway, and earlier in the month on the highway between here and Fort Providence, and there are areas where the cell phones don't work. So what coverage is available in those areas? Thank you.
Mr. Garrity?
Thank you, Mr. Chair. 911 will not be changing the availability of cell phone coverage. That's through the private telco companies. We are certainly advocating increased coverage, as I believe the GNWT is, but 911, the program of 911 does not provide cell phone coverage service.
Ms. Green?
Yeah, I wasn't expecting that it would, but I think to say that 911 is available in the whole of the NWT is misleading, because if there is no cell phone coverage, then there is no way to access 911. And I'm wondering if you are considering making a map that shows areas where there is coverage and where there isn't coverage. My concern is that people may think they're covered because they're at Chan Lake, and they're not covered at Chan Lake. There's no cell phone service there. Thank you.
Mr. Garrity?
So currently there is a cell phone coverage map, and we certainly can add that into our public awareness campaign. We also can be called by other means, such as spot devices, sat phones, landlines, IP phones. So if there's a way to communicate out to the world from the individual, they can communicate with us. So part of the awareness campaign will be, as it should be now, if you're going out into the land, to have a way to communicate. And if you have one of those ways, you can communicate with 911. Absolutely. But we will. Yes, thank you.
Ms. Green?
Yeah, I think that's really important. I don't want people to have a false sense of security that because they're on a road, they have access to 911 when in fact they're in an area where there is no coverage. So I think it's important to make people aware of that with a map that shows the cell phone coverage. You mentioned that there is a building that has been leased. Can you tell us which building?
Thank you, Mr. Chair.
So, Ms. Young?
Typically, we do not release the location of the building for security purposes. Of course, letting people know where something like that is operating makes it a bit of a target for folks that maybe want to do things they shouldn't do. So typically, when we've checked with other jurisdictions, we don't publish the location or advertise the location of the site. But we did go through a tender process with the Department of Infrastructure. One of the things that was very important to us through the tender process was to find a location that had some stability in its construction so that it could withstand some weather events and things like that, so that we were trying to make sure that we had a facility that was in a level of condition that would withstand significant winds, things like that. And also we have arrangements or have arrangements so that if that system went down, if, for example, the phone system went down in that location, that we have ability to transfer and pick up operation of the system in another location. And Ashley could speak to some of the details of that. I know we were talking about something called a go bag yesterday where those opportunities are there. But the advice that we've been given is not to specifically identify the location of the site in a public forum. Thank you, Mr. Chair.
Minister, is this committee able to receive some more detail on the actual facility on a confidential basis, Mr. Minister?
We can look into that. I'll have to talk to my cabinet colleagues. I'll have to talk to the staff. As you've heard, there are security issues, and maybe when we do get it up and running, as much as med response went up working in the old Stanton Hospital, there could possibly be a possibly be a tour, but let me talk to my colleagues. I'll get back to committee on that one. Yeah.
Thank you, Mr. Minister, and it is of interest to this committee, so it would be appreciated if that information can be provided. Even in written form, just to see that information. Ms. Green.
Yeah, thank you. I certainly urge you to provide that information on a confidential basis. I realize that that the dispatchers don't want people knocking on the door, but at the same time, emergency services are provided in a number of locations throughout Yellowknife, and they lock their doors and people don't get in. So I think that's a reasonable request. If there's a tour available when it's up and running that would not impact the operations, that certainly would be useful. Those are all my points. Thank you.
Thank you, Ms. Green. Mr. Minister.
Yeah, I will commit that once everything's up and running and we have our go-live date, even the soft startup will look at providing an invitation to committee to do a tour. Yeah.
Thank you, Mr. Minister. Next with Mr. O'Reilly.
Thanks, Mr. Chair. I guess I'd like to ask about the CRTC work that needs to be done. Do the phone companies make an application to the CRTC to recover charges and set fees and so on? Okay, and I see the minister shaking his head yes. Does that CRTC work have to be done before we start to recover the fees themselves? And how does that play into the start date? Thanks, Mr. Chair.
Mr. Garrity.
Just telco fees for the networking is a separate fee from the $1.70 that's been approved through our Act. Although the telco company would want to be receiving the money for the networking before we go live to pay for the actual network, but they're not linked that way. So our regulation and our $1.70 can be set and ready to go for day one. In association, but not linked to the CRTC fund, if that answers the question right, the CRTC fee.
Mr. O'Reilly.
Thanks, Mr. Chair. So I guess what I want to make sure, though, is that the CRTC work is not going to slow down our implementation, that this is still going to go ahead. We may not, I don't know whether the phone companies can retroactively collect what they think they're entitled to through the CRTC, but I wouldn't want that work to slow down our implementation in any way. And can I get that assurance from the minister? Thanks, Mr. Chair.
Mr. Minister.
Thank you. And as I mentioned earlier, when we did pass the act, the telephone companies were waiting till that act was passed before they did any investments or started the process to start meeting with the CRTC. So really it's dependent on how fast that work goes, and we'll continue to work with the telephone companies to address that. And we will make sure that we keep members of Legislative Assembly up to date on that work. But really, we are waiting till this act was passed before they could start any work. Yeah.
Thank you, Mr. Minister. Mr. O'Reilly.
Thanks, Mr. Chair. So just to nail this down, that's a separate process. That's not going to affect our implementation date. Can I get that assurance? Thanks, Mr. Chair.
Mr. Minister.
Yeah. Thank you. Thank you, Mr. Chair. As you heard in the presentation, once we did pass the act, now we're working on the regulations. So from the regulations, it may take, we should be done the regulations at the end of June. And from June, look at to see when we can do a go live date. Right now, I can't confirm the date, even though that a lot of work still needs to be done, as you've heard with the stakeholders. But there has been substantive work that's already been in place since we passed the act, and we'll just have to continue with the process.
Mr. O'Reilly.
Okay, thanks, Mr. Chair. I look forward to getting an update. I'm not sure I got the answer, but I'll move on. I want to ask about the language services. I know I was trying to explain this to my family over the dinner table a couple of nights ago, and they just didn't believe that this was going to work in all official languages in 80 seconds or whatever that the time frame was in the presentation. Can you folks explain how this service is going to work? Who's actually providing the service, and whether they have contracted interpreters in all of our official languages so that that service can be made available in the 80-second time frame that I think was in the presentation? Thanks, Mr. Chair.
Mr. Garrity?
Thanks, Mr. Chair. The two contractors that historically provide this service for all 911 services, as well as policing agencies, and currently some G&W departments, which would be Language Line and Cantalk, do have confirmed to us in writing that they do have interpreters in all official languages. This process is standardized through our standards in quality management, where someone would call in to 911, and if they're not able to communicate in English, then we would pull in the language line, and an appropriate interpreter would be found for that language. So more than just the official languages, about 147 actually. So that would be, Chinese, Cantonese, and those kind of languages into the call. And then once we find out where the call is locating, what community and what service they want, our intention at the moment is to transfer both the caller and the interpreter to the community service, because the community service may not speak that language that the caller is speaking as well. So we're going to hand both the caller and the interpreter over to the emergency service of the community. We're asking some very quick questions and then handing it off to the actual emergency service in the community. So what is your location? What is the emergency service you need? So it can and does happen in the rest of Canada in about 80 seconds. Where it gets more complicated is if we're providing medical care through our pre-arrival. That does take longer, but the average fire call would be under 80 seconds with interpreter. Thank you.
Mr. O'Reilly?
Okay, thanks. No, that's helpful to get that background. And I think that's something we need to communicate really clearly to the public, is how this is going to work. Because when I was trying to explain it to my family, they didn't believe me. So, but I have some, and I know that you folks had sent us some information about these contractors. I went online and checked them out myself, and I came away feeling more reassured. So, how are we going to communicate this to the public, how this service is going to work, and how are we going to track performance? Thanks, Mr. Chair.
Mr. Minister?
Thank you, Mr. Chair. And as you heard during the presentation, we are starting our campaign right now, and our department's working pretty diligently on that, and just getting that information out. And input, as the member alluded to, is something that we can take into consideration. Thank you.
Mr. O'Reilly?
Yeah, thanks. Maybe I can ask then, and this will be my last one because I know there's other folks that want to speak. How are we going to track performance of the language service? I know that there's public reporting requirements in the Act. The minister's going to table an annual report in the House, but how specifically are we going to track performance of the language service? Thanks, Mr. Chair.
Mr. Garrity?
Thanks, Mr. Chair. We have been in design development with the software manufacturer that will be assisting us through computerized dispatch, and we will be adding in the all official languages into that, so we'll actually be able to track live real-time calls that are coming into us that are not in English, as well as through the call metrics and reporting of that system, we're able to provide details on how long the call was, how long it took to receive interpretation, so all of the metrics which will be part of our public reporting. Thank you.
Thank you. Mr. Thompson, you have the floor.
Thank you, Mr. Chair. So I'm just going to start on slide 3. In the presentation, you talked about the 911 community consultations, and you're going to hit all 33 communities. So who's doing that presentation? Is it the team, or is this going to be regional offices? Thank you, Mr. Chair.
Ms. Gallo?
Thank you, Mr. Chair. It'll be a combination of both. We are going to prepare a common set of slides and Q&As, and then we will work as a team to decide who goes into what communities and timelines, because of course we want to try and do this in a fairly short period of time, so we'll be relying both on regional staff and headquarters staff to deliver the presentation. The actual who's doing which community has not yet been defined. Thank you, Mr. Chair.
Mr. Thompson.
Thank you. So have you guys have you identified the people in the regions that you're going to bring in to do the training to do this? Thank you, Mr. Chair.
Ms. Young.
Thank you, Mr. Chair. We don't anticipate a lot of training because it'll be the delivery of a slide deck speaking to what the implementation plan is and the things that we will be doing. But we have, of course, our video conferencing service. So when we have the slide presentation prepared and the staff that will be delivering it identified, we will do a group training on the slide deck through that means to make sure everyone that will be delivering is comfortable with the materials. Thank you, Mr. Chair.
Mr. Thompson.
Thank you, and I'm happy to hear that. I just want to make sure it's standardized across the board, and so whoever's presenting is going to be given the same message. Ms. Green talked about dead spots on the highway, and I know in my riding we have lots of dead spots. So how are we working with the cell service companies to get, this issue addressed? Because a lot of the accidents we see on the highway are outside of the service, and yeah, it's great to say that you need, all these different technology out there, but some people don't have it, like, satellite radio and stuff like that. So how are we working with the companies to provide this service? Thank you, Mr. Chair.
Mr. Minister.
Yeah, just really quickly, as the member mentioned, we have the Spotify, sat phones. One of the things that we are working on is the cell phone coverage map, so people understand where they can make a phone call. I think there's other departments that are involved with this. Can't speak on the work that they're doing, but definitely bring up a concern with my cabinet colleagues. It is something that we have looked at and want to address, and I'll go to my deputy minister for a little bit more detail. Thank you.
Ms. Young.
Thank you, Mr. Chair. So the minister referenced how we will communicate what's existing out there right now. Again, our primary linkage would be through the Department of Infrastructure because they're, of course, responsible for the highway work. So we've had conversations about some of the new federal funding about access to internet to see whether there's any opportunities available to add infrastructure to any new highways or highway repair jobs that are going on to try to link different pots of money together to expand the cell coverage as part of our highway work, and that would be led by the Department of Infrastructure. But obviously, we're at the table pushing that to happen so that we can make sure that we can deal with some of these concerns that are coming to us. Thank you, Mr. Chair.
Mr. Thompson.
Thank you, Mr. Chair. So on slide 5, we talk about, my colleague, Mr. Raleigh, talked about languages and that and the challenges, and, it's in 80 seconds. I just know in reality, sometimes when people make a phone call to the hospital, they end up not being able to talk. They have to actually try to contact somebody else to do that. So when we're talking about this campaign, is this campaign going out in all our official languages? How is this information getting out there? And what I'm looking at is, our elders that English is their second language. How are we getting that message out to them? Thank you, Mr. Chair.
Mr. Garrity.
Thanks, Mr. Chair. A lot of the material that we hope to produce for 911 will be what we call infographics, so a lot of pictorial stuff, so word light. But in any of the cases where we have those infographics that do have words on them, we will be intending to have them in all 13 official languages, yes. But a lot of it will be infographic, and on certainly our website we'll also have French and English and more as we go.
Mr. Thompson.
Yeah, I'm concerned though, is that how are we getting this information out to the elders, the people that don't have internet, the people that don't watch TV, don't have these accesses? How are we getting that information out there? Because that is the challenge. when I'm talking to elders, English is a second language, this is a challenge. So how are we getting that information out there? Thank you, Mr. Chair.
Mr. Minister.
Thank you. Once we get this campaign up and running and getting the information out there, and after the telcos have done their work and we've done regulations, there's a lot of work that still needs to be completed. We will make it a focus that our elders understand what the 911 service is. And once that campaign is done, we can share it with committee.
Ms. Thompson.
And like I said, we'll take in the input from all members and committee.
Ms. Thompson.
Thank you. On slide 7, you've given us a budget here, and you're breaking out things. I guess my first concern is when I'm looking at these numbers, did these numbers take into effect that we've now got a new collective agreement in place? And because you see numbers that are across the similar, but though it was based on, what numbers did we get on this? Because I'm seeing ongoing, our numbers are going to go up. Thank you, Mr. Chair.
Mr. Minister.
Yeah. Just really quickly before I go to my deputy minister here, we did pass the main estimates, and this was the budget that was presented to the Legislative Assembly, and members agreed on the budget. The agreement happened after the fact, so in short, no, because we just put this budget in. Like I said, it's the first time that we're doing 911. It's going to be a learning process. And as we continue moving forward, it's something that we're going to be looking into, monitoring and evaluating. For a little bit more detail, I will go through you, Mr. Chair, to Deputy Minister. Thank you.
Ms. Young.
Thank you, Mr. Chair. So of course, the budget was prepared based on numbers prior to the collective agreement being signed. It was done, though, based on estimates using similar job descriptions and that to other, the med response type situation. So what will happen now that we have the collective agreement, we have the job descriptions for the positions we're hiring, the new collective agreement will apply to the positions that we're hiring. So obviously, part of the process that happens now within the GNWT is the adjustments to salaries based on the new collective agreement will be, there's a process by which the budgets are adjusted for those changes to be taken into account. Being as this is in our main estimates for 1920, any adjustments to the 1920 budget as a result of the collective agreement would be part of that submission. So these numbers will be adjusted based on the collective agreement through a process that will happen within the GNWT. Thanks, Mr. Chair.
Thank you, Ms. Young. Mr. Thompson, you have just for 2 minutes left.
Yeah, I have, well, 2 questions, but I'll just go to the one here and then I'll turn the floor over. Fees, small communities that don't have RCMP, don't have health centers, will they be charged for this service? Because I mean, in the riding that I represent, I have 4 communities that don't have any of those accesses. And so is that going to be charged to the communities that don't have these services available? Thank you, Mr. Chair.
Mr. Garrity.
Thank you, Mr. Chair. Communities will not be being charged for 911 services. It's the individual phone subscriber, and the individual phone subscriber, specifically if they're a cell phone user, will be able to call 911 from their cell phone anywhere in the territory. So all phone subscribers will be charged the $1.70. But there's no particular fee from 911 to community governments at all.
Mr. Thompson.
Thank you. I guess I maybe clarify. I'm talking about the people in these communities. Like, some of those people don't have cell service. They have a landline. That's their only way of communicating. So what you're telling me is that everybody in the Northwest Territories, if you have a landline or a cell phone, you are going to get charged this. So regardless if you're ever going to use this service, it is going to be charged to. Thank you, Mr. Chair.
Mr. Garrity.
That's correct. It'll be charged regardless. However, there is pre-arrival service being offered, which can help people in communities that don't have other first responders in particular types of cases. So the service is available. It would be technically difficult to specifically choose phones that are in or out. Thanks.
Mr. Thompson, that's time, but we'll have opportunity for a second round. Mr. Garrity, I think you misspoke at one point in your evidence. You said 13 official languages. Is that, can you just clarify that for the record? I just want to make sure that the public is aware of how many languages are actually being contemplated for the service. Mr. Garrity?
11 official languages.
Okay, thank you. I'm just going to ask a few questions before going back to committee members. So Section 11(1) of the bill includes is the official annual reporting of the service. So I'm comparing this section with the performance measurement slide, which is slide 10. And there's a number of things here. The number of calls received in each official language, each community or region of the Northwest Territories, total funds collected through the imposition of a cost recovery fee, the breakdown of operational costs. So not all of those are contemplated on this performance measurement slide. So can you just give me a reassurance that all of these areas that are mandated by legislation are going to the performance measurement work? Mr. Minister.
Thank you, Mr. Chair, and just an update, the presentation was prepared before the final bill was completed after the amendments that were made by committee and that I concurred to, and I can confirm that they will be in there. Yeah.
Thank you, Mr. Minister. Appreciate that. Obviously, we want to make sure everyone's following our own legislation. Secondly, the regulations that are being prepared, not just the fee, but all the regulations that are being prepared, can a draft copy be shared with the committee before they go to cabinet for approval? Just so we can see exactly some of the details that members have been asking about, and certainly many of the details and concerns we heard from the public weren't directly related to legislation. They were more properly captured by regulation. So, Mr. Minister, could you commit or give us indication if you can make that commitment to provide those regulations in draft form to the committee? Mr. Minister.
Thank you, Mr. Chair. As I mentioned, the draft regulation should hopefully be completed by the end of June. This is something I have to take back to my cabinet colleagues and look at sharing with the committee and other members. So I will do that. That's process, and I'll get back to committee on that. Thank you.
Thank you, Mr. Minister. Mr. Simpson, you have the floor. Mr. Simpson. Yeah, no, I know.
Thank you very much. I have a couple more questions related to the communities. When we were in Fort McPherson, there was a question about whether or not the current numbers, so the prefix -1111-2222 and so on, if those numbers that are currently used for emergency services will remain active after 911 is implemented. And that might be up to the communities, but I'd like to get some information from the department about that. Thank you, Mr. Chair.
Ms. Young.
So yes, those numbers will remain active, and especially it's a consideration in the satellite communities, because if the phones go down there, having those local numbers will still allow access to emergency services in the case where 911 may not be able to be connected to. So as a precautionary measure, my staff have been having those conversations with the telephone companies about what makes sense. For the foreseeable future, both numbers will operate. Thank you, Mr. Chair.
Mr. Simpson.
Thank you. Another question that arose was that some communities have their own emergency response regimes in case of a forest fire or a gas leak. Will people be able to call 911 and tap into or for concerns like that as well, or is it just police, fire, ambulance? Thank you, Mr. Chair.
Mr. Minister.
I think communities have become accustomed to the emergency responses that they had. Well, one thing that we've done is worked with communities on their emergency response plans. They'll continue to do that, I'm sure, for quicker response times. 911 is just an added benefit for people that might be new to the community that need to access those services. They'll continue to operate, and I think anybody that uses their emergency response teams know those people. All these communities are I think, small enough that they know who to call to get the help that they need. And through you, Mr. Chair, with a little bit more detail, I'll go to my Deputy Minister. Thank you.
Ms. Young.
Thank you, Mr. Chair. So committee members may remember when we first started talking about 911, one of the concepts that we talked about is 911 will simply be a mechanism to access services that are existing on the ground. And so part of the work that's happening currently is we're working with each community to figure out what system is currently in place and how to connect into that. So if they have a system in place currently for accessing for emergency, to access emergency response, then that will be the conversation that will be happening. We've also talked about it will take into account things like the NWT spills line, the mental health lines and things like of that nature, so that it truly is a mechanism to access services that already exist. So those conversations with each community will be taking place, and that is, again, as part of the purpose of the soft launch, is to then test all of those numbers and make sure the system is working as it's intended to. Thank you, Mr. Chair.
Ms. Young. Mr. Simpson.
Thank you, and that answers some of my other questions as well. So I just want to ask about civic addressing. It's my understanding that civic addressing isn't a requirement for 911, the basic 911 service we have. Despite that, MACA is working with the communities to address the issue of civic addressing. And the work started in April 2018, according to the presentation. So I'd like to know some detail about that. What type of support is being provided to the communities? Is it only technical, or is it also financial? And when can we expect this work to be completed or substantially completed across the territory? Thank you.
Ms. Young.
Thank you, Mr. Chair. So specific to the efforts that are underway, what we're doing is we're tying it into updates of community plans. And so I believe it's 9 communities. We're currently in various stages of working with them to update their community plans. There are template models that can be used for addressing, so that we have a tool that can be used to help put an addressing system in place as part of that community plan update. With regards to the resourcing, there are a number of different places within there are a number of places within the various funding that's provided to communities where the cost of the community plan can be paid for. So, for example, updating their community plan can be paid for out of their community public infrastructure funding, out of their O&M funding, out of their gas tax funding. So they have a number of places where the resources to put an addressing system in place can be covered as part of that exercise. And then continuing from there, so first off, again, because you're accessing an existing system, you're dialing in to the currently emergency response system within the community. That's why we've said, it didn't have to be in place when 911 went live, because you're still calling the fire department. So when you explain that it's X person's house, as you would normally when you call in there, the response will continue. But MACA is continuing its efforts to update community plans. So we will continue, whether it will be 9 a year or however many it will take, because community planning updates also include a number of other things like Indigenous consultation, Aboriginal consultation requirements and things of that nature. So how much time each plan takes and when they do it, we'll work with each community to try and get those things on a schedule to update over the next few years. Thank you, Mr. Chair.
Thank you, Ms. Young. Okay, thank you. Mr. Thompson.
Thank you, Mr. Chair. Just going back to slide 7 here about the budget and that. In the budget, you talk about public communications. There's $33,000 the first year, but there's no cost to it for the second year. So could you explain why we wouldn't have any additional costs? I know, you do internal stuff, but there still should be a cost to getting the communication out there. Thank you, Mr. Chair.
Ms. Young.
Thank you, Mr. Chair. And again, given the fiscal framework and the desire to try to keep costs at a level where we're being effective with our program, but also keeping costs to residents low, this budget was developed on the assumption that we would do a lot of the infrastructure costs, the signage, the things of that nature the first year, and then pick that up with internal activities, communication activities, which would be paid for out of our existing O&M budget and wouldn't cost any additional costs in the second year. Again, we will see how effective that is in our first year's implementation, whether we need to continue to invest in communications with additional budget, but at this point, that was the assumption upon which this budget was based. Thank you, Mr. Chair.
Mr. Thompson.
Thank you. So I'm looking at this slide here, and it says public communication and signage. So you have two different lines, and I see the signage ain't happening, but again, I'm confused here. We talk about signage and public communication, and there's a budget line for that, but you also have a line for signage. So is it just combined and that you just broke it down in these two areas, or? Thank you, Mr. Chair.
Ms. Young.
Thank you, Mr. Chair. So there will be both activities happening. The public communications obviously includes other things like webinars, if we do that, pamphlets, fridge magnets, any other mechanism that we want to pay for in the first year to try to spread the word as quickly as possible. And then again, anticipating no additional costs for those items in the second year. So my mistake in combining the two. Mentally, to me, they're both our effort in communications. Thank you, Mr. Chair.
Mr. Thompson.
Thank you. So when we talk about initial training, I know I see there's a budget for $57,000. That's great. But what about ongoing training? Because, I mean, we're going to have new staff coming in, you know, and I would hope that, I'm assuming that the training is going to be just as intense for new people, and then you're going to be able to upgrade people. So why isn't there a budget line for training in this proposal here, or estimated budget? Thank you, Mr. Chair.
Ms. Young.
Thank you, Mr. Chair. And if we look at the MACA budget overall, there isn't a specific training line, although we do training for our staff all the time. So this budget identified the initial cost to get all of the first hires trained to the level that's required for the accreditation. Again, that would be an ongoing O&M cost that would be picked up as part of the budget, but just not separated out in a line in the budget moving forward. It would be absolutely expected that any new staff that we are training would be trained to the same level, or if there's ongoing training requirements for accreditation, that would be maintained. The additional piece that we are very conscious of and making sure we've got training available is, and sorry, I've just lost the words, but basically the stress management part of the job in dealing with crisis management and things like that. We are designing and planning training specific to that aspect of the job. Again, once we've got that material, it can be ongoing delivery through our existing School of Community Government to deliver on an ongoing basis. Thank you, Mr. Chair.
Thank you, Ms. Young. Mr. Thompson.
So in program requirements, I see the amount's going down, but lease space. So can you explain how it actually is going down, considering it's, you know, program requirements, lease spacing is still going to be consistent. It's going to cost you X amount of dollars and that. So could you explain why there's a reduction? Thank you.
Ms. Young.
Thank you, Mr. Chair, and I believe, and we'll look to Ashley just to confirm, I believe that includes, the first year includes some of the setup costs for retrofit of the space, installation of the network, and costs of such nature, which would then be just ongoing after the first year's implementation. Thank you, Mr. Chair.
Mr. Thompson.
Thank you, Mr. Chair. No further questions.
Thank you, Mr. Thompson. Committee, we have to give way to the next committee, but I just had one more question about this accreditation process, and I think it's peppered throughout the presentation deck, but to my knowledge, the committee hasn't received any information on 911 accreditation. From my knowledge of, other specialized performances, there are various accreditation programs that you need, like first aid or things like that. So it doesn't surprise me, but it would be appreciated if we could have some written material sent to us on what that accreditation looks like, what the costs are, what the ongoing costs are of accreditation, so we can get a better sense. Mr. Minister, can you make that commitment, please?
Thank you, Mr. Chair. Yes, well, I'll make the commitment, and as per the report that committee did do, and read into the House, we will also commit to the evaluation and ongoing monitoring process and the reporting. So, as I mentioned, this is new, and it's going to be definitely a learning curve for us, but I think we're on the right track, and we will work with committee to make sure that committee and all members of the Legislative Assembly are updated as the program rolls out.
Thank you, Mr. Minister. And, on behalf of committee, I will say that the members of this committee have appreciated the working relationship with the department on this and with yourself as minister. This is a very collaborative process, and I think we're very satisfied that we're moving in the right direction. Obviously, there needs to be some tweaks. We need to continue to work together to make sure the best interests of Northerners are maintained through the service. But I think we're well on the way to doing that. So we look forward to receiving more information as we've discussed today. And with that, I'll allow you to provide any closing comments you may have. Mr. Minister.
Yep, thank you, Mr. Chair. I would like to thank the committee for their input, the report that they read into the House when we passed the Act, working in collaboration to get this through. Thanks for the questions today. First of all, I'd also like to give a big thank you to the staff that have put a lot of work into this. Thanks to the communities that have given input to help us with direction. And this is more about just an act. It's about the safety, health, and well-being of our residents, and look forward to moving forward. So with that, Mussy.
Thank you, Mr. Minister. Thank you, committee. We are, the public portion is complete. You may be excused. We'll move in camera for a discussion.
Thanks, guys.
Thank you. Can I get a motion? Mr. Nadley, all in favor? Thank you. Committee, we're in camera. We'll allow our witnesses and members of the public to leave.